Good morning and welcome to the AERP Arizona Community Education Program. This is a volunteer-led program sponsored by AERP Arizona, and we conduct conversations on topics of interest to the community, such as Social Security, Medicare, finances, caregiving, and fraud, among others. Today's topic is Medicare, and to go over this topic, I'd like to introduce one of our volunteers, Mr. Rob Foster. Rob?
Okay, thank you, Jerry. This is a very appropriate time to talk about Medicare because the open enrollment period has begun and will continue until mid-December. So this is the first of 3 talks about Medicare, and we're going to start with an overview. So we are going to provide basic information on 2 forms of Medicare, Original and Medicare Advantage. Now, the topics I will be discussing are at a high level, 7-point comparison, and then the next level going into what the various elements of Medicare are. And finally, we will talk about resources. Now, who qualifies? You must be 65 or older, plus have accumulated 40 credits, which is equivalent to 10 years of employment, in order to qualify. Also, anyone who has been on SSDI for 2 years or has end-stage renal failure. There are 2 options: Original Medicare, which has been around for quite a while, and Medicare Advantage. And this slide explains that Original has Part A, which is hospital insurance, and you have already paid for that during your working years. Advantage has exactly the same Part A, which is automatic. Part B is medical insurance, and this is optional for people who may not choose to pay for it right away. Unfortunately, if you decide later on you would like Part B, there will be a penalty. Medicare Advantage has Part B, which is included, and also Part D, which includes prescription drugs and the same with Original Medicare. Again, this coverage is optional, but if you delay, there will be a penalty. Now, the 7-point comparison between Original and Medicare. Original is fee for service. You can go to the provider that you wish to visit, whereas with Medicare Advantage, you are dealing with either a health maintenance organization or a preferred provider organization, and you are required to visit those people who are within those networks. And managed means that you have a primary care physician that you select, and that physician will provide referrals to specialists. With Original, you have a choice of providers as long as they accept Medicare. And with Advantage, you're dealing with the network doctors and hospitals. With Original, there is no out-of-pocket limit and we'll talk more to that later on. With Medicare Advantage, there typically is an out-of-pocket limit, which varies by the provider or the Medicare Advantage plan. Part B premium, as I indicated earlier, is purchased, and the same with Medicare Advantage. Part B has a 20% co-insurance, and Advantage has co-payments. Co-payments are typically less than the 20% co-insurance. Part D, the drug plan, which was introduced, I believe, in 2006, is purchased in original Medicare, and Part D is included in Medicare Advantage. Now, at this point, it may sound like Medicare Advantage is the way to go, but point number 7 is important to a lot of people because original may be combined with a supplemental policy, which is purchased, that will cover some, if not all, of your out-of-pocket costs. Medicare Advantage does not have an option to buy a Medigap policy. Now, the resources that are available within Arizona is to begin with this website, the SHIP website, and it will ask you to enter your state, which of course is Arizona, and the next screen will lead you to the Arizona Health Insurance Program, and that is the 800 number for that program. It is an excellent source of information and can even provide in-home and on-site counseling. And they are very helpful to a variety of clients. You can also go to the Medicare website or call and speak with them. And you can go to the AARP website, which will also address questions related to Medicare, or you can call the 888 number to speak to a person. With that, I want to thank you and encourage you to watch the next 2 presentations that will go into much more detail about original Medicare and Medicare Advantage.